You're a patient that presents with ankle arthritis to my clinic. What are your options? The options are ankle fusion or ankle replacement when we're talking about the surgical options. You've reached the point where you're bone-on-bone arthritis of the ankle, and the main reason why most of these patients are seeing me, pain that affects function. When a patient has an ankle fusion, you get asked, what do you do with an ankle fusion? And they can be done either by coming through the fibula, which is the smaller bone here, and accessing the ankle joint from the side, or they can be done arthroscopically with small poke holes in the front of the ankle where we are able to clean the ankle out of the cartilage, and then we fix the ankle and essentially glue the tibia to the talus in this case, which fixes the ankle joint. So the ankle joint now is gone and the two bones become, in this case now, one bone. When that happens, the pain goes away. So that's the idea behind ankle arthrodesis. Now, patients always ask me, well, how is it that I'll have any motion once you lock up my ankle joint? And the answer is these other joints downstream, so mainly the talonavicular and the calcaneocuboid joint, now will see additional motion through those joints. And patients after surgery do have accommodated motion that comes through those joints, and it's actually quite functional motion. It does work well. The main downside is that over time we know that the adjacent joints can become arthritic, and in some of those patients they may actually require additional surgical procedures to fuse adjacent joints. So that is one consideration. Having said that, the number is somewhere between 5 and 10% of all patients with ankle fusions will need adjacent joint fusion surgery. So it's still a relatively small group of patients that may need that. Most patients, when they come in the office and they're told that they have a diagnosis of ankle arthritis, they want to know what their options are and are they a candidate for an ankle replacement. Ankle replacement now is becoming a viable option in the United States and really worldwide for the treatment of patients with ankle arthritis. An ankle replacement is simply put in through an anterior approach to the ankle, so an incision that is made in the front part of your ankle. We dissect down to the ankle joint. We make bone cuts through the tibia and talus, removing a small section of bone on each side that allows us to implant the metallic components that you see here. We then insert in a very dense piece of plastic, and this serves as the gliding motion between the two metallic components. From an ankle replacement standpoint, we like to see patients that are a little more upwards in their years, late 50s, 60s, and even into the 70s. Why is that? Well, we know that ankle replacements don't last forever, and certainly revisions are difficult to perform. And after revision, you can always go back in and do a fusion, but that requires removing the implant, which leaves a fairly big void. There really is an ideal patient that we're looking for an ankle replacement. And if you fit that bill, then certainly ankle replacement is an option for you.